When I had my first baby, I did a ton of research into how I can have a natural birth, and I got it. Unfortunately, I failed to look into the post-birth procedures that they routinely perform on mothers and babies, and both my child and myself suffered as a result, and I do not want the same to happen to you. So in this video, I'm gonna go over it all. By the end, you'll know the pros and cons of these procedures so you and your baby can get off to the best possible start. But first, my name is Maria. I'm a doula, Lamaze certified childbirth educator, and owner of the Primal pregnancy app, an evidence-based resource for holistic-minded women who want a healthy baby and an empowering birth experience. Okay, the first procedure that is completely unnecessary and 100% harmful is early cord clamping. Right when the baby comes out, the doctor puts a clamp on the umbilical cord to stop the blood flow from the placenta to the baby. Afterwards, the cord is cut. Why is this problematic? Because that blood belongs in the baby's body. If you wait just a few minutes after birth, then all of the blood will flow into the baby where it belongs. If you clamp it too soon, the baby loses anywhere from 30 to 50% of their blood volume. Imagine if you lost 50% of your blood volume, you'd be hospitalized. And United States obstetricians are just routinely doing this to newborns, and then everybody's shocked that we have the highest neonatal death rates in the developed world. No kidding. Just take a look at these two pictures. On the left, you see a baby fresh out of the womb. He's thinner, his skin has a bluish tint to it, and then just a minute later on the right, the same baby is plump. He's pink, he's more robust. Why? Well, take a look at the cord. It went from blue to white, meaning that all of the blood drained from the placenta into the baby where it belongs. When babies get their full blood supply, it improves their iron levels for up to 6 months postpartum. It decreases death rates, incidence of necrotizing enterocolitis, neurodevelopmental problems. It improves lung function. Whether your baby is preterm, full term, whatever the case may be, every child will benefit from delayed cord clamping. So why, you ask, do hospitals still routinely deprive every baby of this benefit? Because they're behind. They used to believe that clamping the cord prevented postpartum hemorrhage for the mom. This was proven to be false. However, because hospitals are on average 17 years behind on the data, they still continue to do it. So if you want a healthy baby, do not let them clamp the cord until it has turned white and stopped pulsing. Put it in your birth plan and enforce those wishes. You will probably need to remind them several times because hospital staff, they just go on autopilot. I've seen it way too many times. They promise you one thing and then 5 minutes later they do the complete opposite and just go, oops, I forgot. If this happens to you and they clamp the cord despite your protestations, you can go ahead and unclamp it. You might need a paper clip to do this. Once it's unclamped, you or dad can milk the cord to get every single drop of blood back into your baby where it belongs. If your baby needs immediate care or resuscitation, fine. They can do all of that at the bedside while the cord is still intact. And in these cases, it is especially important that your baby gets their full blood volume. Now, they're probably gonna lie and say that they have to cut the cord to get the baby to the warmer. That's what they said to me with my first child. What they're not gonna tell you is that they can roll that warmer right on over and do all of those post-birth procedures while the cord is still intact. And if your child is in danger, isn't breathing, whatever the case may be, the umbilical cord is literally supplying them with oxygen. You're gonna cut off their oxygen supply to help them breathe. It doesn't make any sense. So delayed cord clamping, do not let this one go. Okay, the next completely unnecessary thing they do to neonates is wiping them down right after birth. They do this for 2 reasons. The first being to stimulate a cry and get the baby breathing air. So they do this to every single baby the second they emerge, which sounds like a great idea, except for the fact that a 2020 analysis of 10,000 births showed that immediate and thorough drying and rubbing is linked to increased neonatal mortality. If the newborn is already crying, which most of them are, you don't need to do anything more. Extra stimulation in this case causes stress to the newborn, as well as bradycardia, which is a slowing down of the heartbeat. So all of that rubbing and stimulation poses danger to an infant who doesn't need it. If the baby is not breathing well, gentle drying may stimulate breathing, although further evidence is needed to confirm, but the routine aggressive rubbing that they do is pointless, even dangerous. This is why the World Health Organization guidelines state that even if the baby is not breathing, you still shouldn't do the aggressive rubbing. Just 2 to 3 gentle little back rubs are sufficient. Nothing extra, nothing forceful, and that is all they need. Now, the second reason that they dry and rub the baby is to reduce neonatal hypothermia. Your baby is going to be cold when they exit the womb. Like when you step out of a hot shower, you feel extra cold until you dry off. So they dry the baby off to keep them warm. Except for the fact that skin to skin with the mother takes care of this. Your body is so in tune with your baby that it will literally heat up or cool down according to your child's exact thermal needs. You keep your baby warm. They don't need extra drying or rubbing. Nature has already figured this out. Another huge downside to rubbing the baby is losing the vernix. This is a waxy white substance that protects the baby's delicate skin inside the womb. Once the baby is born, vernix continues to help your baby fight off bacteria and regulate their temperature, which is ironic because they rub off the vernix to help with temperature, but you don't need to do that. You cannot improve upon this design. Leave the vernix intact. Gently rub it into their skin like a lotion to boost your baby's immune system, keep them warm, and protect their delicate skin. Now, you're probably going to have to fight off at least one nurse from rubbing off the vernix, and while this is happening, you'll have to prevent another nurse from suctioning your baby. This is why you really need a good birth partner who can support you in that moment. If you want to watch my video for birth partners, you can do so right here. Hospital staff suction babies to clear their airways of secretions, meconium, any fluids in the lungs. So yes, it's important to suction a baby who's born limp or aspirated meconium, clearly not breathing well. However, when they routinely suction every baby, including the healthy ones, this leads to bradycardia, apnea, lower oxygen saturation levels, all really scary stuff. So if your baby is doing okay, it is not necessary and it will do more harm than good. Hopefully after birth, baby is on your chest, skin to skin. The next thing they're gonna try to do is give your baby a hat. And you can just take this off yourself. The theory went that a hat would help your baby regulate their temperature, but a 2008 study from the British Medical Journal debunked this. Like most everything else, a hat is just one more intervention that your baby does not need, and it will do more harm than good, especially for you, mama. You want that newborn scent to remain strong. This will help you release oxytocin, which gets your placenta out, and it lessens postpartum hemorrhage, which is the #1 cause of maternal death in childbirth. So take that hat right off and sniff your baby. It will help lessen your bleeding and keep you safe. The next thing that most hospitals will try to foist upon your child is an eye ointment called erythromycin. And it can be really helpful. When a mother is STD positive with chlamydia or gonorrhea, this ointment protects her baby from developing an eye infection and potential blindness. So super helpful when it's needed. But if you don't have an STD, your baby does not need erythromycin. Now, they'll tell you, oh, well, we just give it to every baby just to be safe, except for the fact that the ointment blinds the baby for several hours right when they need to see and connect with you. Your baby can only see about 12 inches away at birth, which is roughly the distance between your breast and your face. And this design is purposeful. As your baby lies skin to skin with you, nursing in your arms, they want to look up and see your face. Those first few hours with your child set the stage for the rest of your relationship. So if your baby does not need erythromycin, don't give them erythromycin. Enjoy that precious bond to its fullest. Speaking of unnecessary STD prevention, The hepatitis B vaccine is given to every newborn regardless of the mother's Hep B status. And this is very problematic. The aluminum contained in this vaccine is 75 times over the amount considered safe for newborns. Excessive aluminum leads to bone disease, brain damage, and, as Robert F. Kennedy recently uncovered, autism. He revealed a study that was covered up by Big Pharma where the Hep B vaccine was linked to an 1,135% increase in the rates of autism diagnoses. And I'll link that below because I know you're gonna wanna fact check. Now, I'm not saying don't get your child the Hep B vaccine. If you tested positive, then the benefits may outweigh the costs. It's up to you and your personal risk tolerance. But if you don't have Hep B, then your baby does not need that extra exposure to harm. And just when you think your baby couldn't be poked or prodded anymore, that's when they bring out the vitamin K shot. Babies are born with low vitamin K, so if they get a cut or a vaccine, the fear is that they won't be able to produce the clotting factors needed to stop the bleeding. The vitamin K shot gives them those clotting factors until the baby starts making their own vitamin K about 8 days later. Now, there are pros and cons to the vitamin K shot. I'm gonna show you both sides so that you can make an informed decision. Pros are, it can save lives. Vitamin K deficiency bleeding is really, really rare, between 1 in 14,000 to 1 in 25,000. But when a baby does get it, it can cause seizures, brain damage, even death. So really dangerous, obviously. And in a lot of cases, the vitamin K shot could protect your baby, especially if they're born premature. Infants who get the shot are 81 times less likely to develop vitamin K deficiency bleeding, so it definitely has its merits. As for the cons, the vitamin K shot doesn't actually contain any vitamin K. It contains synthetic lab-made vitamin K1 in a dosage that is 100 times greater than the recommended daily allowance for infants. Side effects include anaphylaxis, respiratory distress, swelling, rashes, and that's just full-term babies. In premature babies, the benzyl alcohol contained in the shot is lethal. It was shown to cause gasping syndrome and is now no longer recommended by the FDA. Of course, hospitals still administer it, often without permission, but who asked me? So what's a mom to do? The shot poses risks, but not getting the shot also poses risks. Look, I can't tell you what to do. I will get sued. But what I can tell you is that a study in the journal Pediatrics showed that mothers who consumed vitamin K had colostrum with higher vitamin K, and their babies had more clotting factors compared to the control group, just from diet alone. And by the way, the essential smoothies in the Primal pregnancy app contain 100% of your daily vitamin K needs. I had one of these smoothies every day when I was pregnant and postpartum, and my baby did not get the vitamin K shot. And when my midwife pricked his heel for a screening test, nothing came out. He just wouldn't bleed. She came back the next day, same thing. His clotting factors worked so well, and I attribute that to my diet. Now, you may have heard that breast milk is low in vitamin K. This is true, but colostrum is higher in vitamin K, and it can get into your baby's system, as shown by the pediatric study that I mentioned earlier. So diet alone might do the trick, but if you're not completely confident in food-based medicine, totally fair. There's also oral vitamin K. Not every hospital offers it, so you might need to ask around, but oral vitamin K is a much gentler option than the shot. No preservatives, it's not invasive, so that might be a better option if you do want to stick with Western medicine. Next on the hospital agenda is weighing, measuring, and getting footprints, which isn't a bad thing unless it interrupts skin to skin. A lot of United States hospitals still take the baby immediately after birth, weigh the baby, measure the baby, and then hand mom this tightly wrapped little bundle when what both of you need as soon as possible is skin-on-skin contact. The oxytocin will lessen your bleeding. It'll regulate your baby's temperature, facilitate successful breastfeeding, bonding. My first baby was taken away from me, and when they handed her back a few minutes later, I hate admitting this because I love my daughter, but I did not bond with her for several days, and I attribute that to being deprived of skin to skin, as well as Pitocin, which is another story. Of course, I loved her, but that primal instinctual drive was not there at first. Holding her felt like holding somebody else's kid, and it took several days to finally develop that connection. Fortunately, a lot of United States hospitals are promoting immediate skin-to-skin these days, but if not, this is really something you want to push for. It's not enough to just write it in your birth plan, because as you know by now, hospital staff, they just go on autopilot. From cord clamping to vaccinating, there are a lot of post-birth procedures that should be delayed or avoided altogether for your baby. Now let's talk about you and how those first 10 minutes should go so as to facilitate breastfeeding and an easier recovery, as well as a strong bond with your newborn. It starts with the delivery of your placenta. Healthcare providers want that thing out fast, and this is because as long as your placenta is attached to the uterus, blood can still flow out, meaning you're at risk of postpartum hemorrhage, which is super scary. But what they do to prevent this is rarely helpful. It's called active management of the third stage of labor. This is where they shoot you up with drugs that inhibit breastfeeding. They yank on your umbilical cord until it rips off the uterus, and then they rub your tortured fundus, which is one of the top 3 most painful things I have ever experienced in my life. I wish I had known that I could have just said no to all of this. I didn't need any of it. The downsides to active management of the third stage are many, including less bonding with your baby due to the Pitocin, delayed lactation, which causes a whole lot of breastfeeding problems, excruciating pain from the fundal massage. They call it the devil's massage for a good reason, and to top it all off, sometimes it causes postpartum hemorrhage, which is the very thing it's supposed to prevent. This happens when they yank on your umbilical cord so forcefully that the placenta rips off, leaving little bits still stuck inside your uterus. Blood continues to flow out through those little bits, so they then ramp up the Pitocin even more, and if that doesn't work, they send you in for surgery. Now, if you're in an emergency situation, then the benefits may outweigh the harms, and there is a time and place for active management of the third stage. The problem arises when you use it on every single woman after every single birth. If you are not at risk for postpartum hemorrhage, then you can decline all of this. Make it clear that you want passive management of the third stage of labor. This is where the placenta delivers itself, cord clamping is delayed, and no fundal massage is given. For most women, this is the best option, so put passive third stage management into your birth plan. And I'll also add that skin-to-skin contact and breastfeeding are highly effective at producing the oxytocin you need to expel the placenta and stop your bleeding. So nature already has this one figured out. It already wants to stop whatever postpartum hemorrhage may occur. You are designed to hold your baby after birth. It's good for you and it's good for them. The next thing they're gonna do is sell your organs without your consent. I'm not kidding. Hospitals take your placenta, they sell it to a biotech firm, and then make upwards of $50,000 on your body part without your knowledge or consent. And I'll also point out that placentas from a cesarean birth are the ones in the best condition to be sold. Just food for thought. Now, it's illegal to sell organs for profit in the United States, so instead, hospitals classify your placenta as medical waste. And then they don't sell, they transfer it to processors who then give donations. Legally, no one's buying or selling anything, and yet they somehow end up with millions of dollars in their pockets, all thanks to you. So if you're okay with this, fine, but if not, keep your placenta. It belongs to you. If anyone is making money off your organ, it should certainly be you. I ate mine. I had it encapsulated. Some women bury it in their backyard and they plant a tree for their baby. Now, a lot of hospitals will fight you on this, so you might need to be strategic about sneaking it out. You may need to get your doula on board for that. All right, I hope you liked this video. If you did, you're gonna love my other stuff, so hit subscribe to get the evidence-based tips you need to have the kind of birth you want, and I will see you next time.